Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about HIV symptoms. So, acquired immunodeficiency syndrome is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus. By damaging your immune system, HIV interferes with your body's ability to fight infection and disease. As regards HIV symptoms, HIV is a sexually transmitted infection. It can also be spread by contact with infected blood and from illicit injection, drug use, or sharing needles. It can also be spread from mother to child during pregnancy, child birth, or breastfeeding. Without medication, it may take years before HIV weakens your immunity. So, to the point that you have AIDS. There is no cure of HIV/AIDS, but medications can control infection and prevent progression of the disease. Antiviral treatments for HIV have reduced AIDS deaths around the world, and the international organizations are working to increase the availability of prevention measures and treatment in resource poor countries. As regards the symptoms of HIV and AIDS vary depending on the phase of infection. As regards primary infection or acute HIV, some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. This illness known as primary acute HIV infection. This may last for a few weeks. Possible signs and symptoms include fever, headache, muscle aches, and joint pain. Sometimes rash, sore throat, and painful mouth sores. Swollen lymph nodes, mainly on the neck, diarrhea, weight loss, cough, and also night sweats. These symptoms can also be mild. You might not even notice them. However, the amount of virus in your bloodstreams or viral load is quite high at this time. As a result, the infection spreads more easily during primary infection than during the next stage. As regard the other clinical latent infection or chronic HIV, in this stage of infection, HIV is still present in the body and in white blood cells. However, many people may not have any symptoms or infections during this time. This stage can last for many years if you are not receiving antiretroviral therapy. Some people develop more severe disease much sooner. As regards symptomatic HIV infection, as the virus continues to multiply and destroy your immune cells, the cells in your body that help fight off germs, you may develop mild infections or chronic signs and symptoms, such as fever, fatigue, swollen lymph nodes, often one of the first signs of HIV infection. Sometimes diarrhea, weight loss, oral yeast infection, which is called thrush. Sometimes shingles, uh, herpes zoster, pneumonia, progression to AIDS. Access to better antiviral treatments has dramatically decreased deaths from AIDS worldwide, even in resource poor countries. Thanks to these life saving treatments, Most people with HIV in the USA today do not develop AIDS. Untreated HIV typically turns into AIDS in about 8 to 10 years. When AIDS occurs, your immune system has been severely damaged. You will be more likely to develop diseases that would not usually cause illness in a person with a healthy immune system. These are called opportunistic infections or opportunistic cancers. The signs and the symptoms of some of these infections may include sweats, chills, recurring, recurring fever, chronic diarrhea, swollen lymph nodes, persistent white spots, or unusual lesions on your tongue or in your mouth, persistent unexplained fatigue, weakness, weight loss, skin rashes, or bumps. So, if this occurs, this means that your condition progressed to AIDS. As regard causes, HIV is caused by a virus. It can spread through sexual contact, illicit injection, drug use, or sharing needles contact with infected blood, or from mother to child during pregnancy, childbirth, or breastfeeding. HIV destroys CD4 T cells, white blood cells that play a large role in helping your body fight disease. The fewer CD4 T cells you have, the weaker your immune system becomes. So, how does HIV become AIDS? You can have an HIV infection with a few or no symptoms for years before it turns into AIDS. AIDS is diagnosed when the CD4 T cells count falls below 200 or you have an AIDS defining complications such as a serious infection or cancer. How HIV spread? It can spread to become infected with HIV infected blood, semen, or vaginal secretions must enter your body. This can happen by having sex, by having sharing needles, from blood transfusions, but this is now very rare, or during pregnancy or delivery or through breastfeeding. So, this is the methods of transmission of HIV. Thank you very much.